Hello, everyone. Welcome back to A to Z Healthcare Channel. Today, we're going to talk about a common and often bothersome condition that many of us have experienced at some point in our lives: tension headaches. But first, let's start by understanding what tension headache is. A tension headache is a common type of headache characterized by mild to moderate, steady, and dull pain that typically affects both sides of the head. It is often described as a sensation of pressure or tightness around the forehead or the back of the head and neck. Tension headaches are generally not accompanied by other symptoms like nausea or sensitivity to light and sound, and they are not typically worsened by physical activity. Causes of tension headache. Scientists have an idea of what may set off a tension headache, but the specific causes remain unclear. Genetics are not thought to be a factor. They can be triggered by: Number 1, stress. Number 2, lack of sleep. Number 3, anxiety. Number 4, depression. Number 5, repressed resentment, anger, and hostility. Symptoms of tension headache. Tension headaches. The signs and symptoms of a tension headache can vary from person to person, but they generally include: Number 1, mild to moderate head pain. Number 2, it feels like a tight band around the head. Number 3, pain on both sides of the head. Number 4, headache can last from 30 minutes to several days. Number 5, no aura or nausea, unlike migraines. Number 6, sometimes sensitivity to light and sound. Number 7, muscle tenderness in the scalp, neck, and shoulders. Number 8, pain may worsen with activity, but not always. Remember, if you experience severe or sudden headaches, or if you have other concerning symptoms, it's essential to consult a healthcare professional for proper evaluation and guidance. Risk factors of tension headache. Number 1, stress. High levels of stress can increase the likelihood of tension headaches. Number 2, poor posture. Posture and prolonged positions that strain the neck and shoulder muscles can contribute to these headaches. Number 3, eye strain. Spending long hours staring at screens or engaging in visually intensive tasks can trigger tension headaches. Number 4, lack of sleep. Insufficient sleep or poor sleep quality may be a risk factor for these headaches. Number 5, anxiety and depression. Mental health conditions like anxiety and depression can be associated with an increased risk of tension headaches. Number 6, physical inactivity. Lack of regular physical activity and exercise can make one more susceptible to these headaches. Treatment for tension headache. Number 1, over-the-counter pain medications. Non-prescription pain relievers like acetaminophen, Tylenol, ibuprofen, Advil, Motrin, or aspirin can help alleviate headache pain. Be sure to follow the dosing instructions on the label and consult a healthcare professional if you have any concerns or underlying medical conditions. Number 2, prescription medications. In cases of severe or chronic tension headaches, a healthcare provider may prescribe stronger pain relievers or muscle relaxants. They might also consider tricyclic antidepressants, such as amitriptyline, or selective serotonin reuptake inhibitors, SSRIs, as they can help prevent tension headaches. Number 3, muscle relaxants. If muscle tension is a significant contributor to your headaches, your doctor may prescribe a muscle relaxant, such as cyclobenzaprine, Flexeril, to reduce muscle tightness. Number 4, biofeedback. This technique involves learning to control physiological functions, such as muscle tension, through electronic monitoring. Biofeedback can help individuals become more aware of tension and learn to relax the muscles that contribute to headaches. Number 5, stress management. Since stress is a common trigger for tension headaches, stress management techniques like relaxation exercises, deep breathing, meditation, and yoga can be beneficial. Cognitive behavioral therapy, CBT, may also help in identifying and managing stressors. Number 6, hot or cold compress. Applying a hot or cold compress to the affected area, neck, forehead, or temples, can sometimes provide relief. Experiment with both to see which works better for you. So, there you have it, everything you need to know about tension headaches and how to manage them. Remember, if your headaches persist or worsen, it's crucial to consult a healthcare professional for proper diagnosis and treatment. If you found this video helpful, please give it a thumbs up, share it with friends and family, and subscribe to our channel for more informative content. And we'll see you in the next video. Thanks for watching.